Hi everyone, welcome to Medical Microbiology. Today we will discuss chapter 18, which is about gram-positive and gram-negative coccus of medical importance. So we'll talk about the uh, coccus bacteria in this chapter, especially the one that causing infection to human. Okay, there are several groups that can cause disease to human. The first one is the Staphylococcus group. Remember, Staphylo mean cluster and coccus mean round. Okay, so it's gonna be look like this. So round bacteria that cluster together to make an arrangement look like grapes. So this is what we call the Staphylococcus bacteria. The second one is the Streptococcus bacteria. This is gonna be strepto mean chain. So it's gonna be round bacteria that will arrange into chains arrangement. Right? And then Neisseria, Branhamella, Moraxella, Acinetobacter, they have a very similar arrangement, which is round bacteria, and usually they combine into two or diplococcus bacteria. So mostly it will be uh, coccus bacteria that arrange into two colony. Okay, so two uh, units in one bacteria. So it's a diplococcus type of bacteria. Diplo mean two, right? Coccus is round. So this is going to be similar characters, mostly for Neisseria, Branhamella, Moraxella, and Acinetobacter. Okay, we will start with the first one. So we're gonna see the list of these bacteria first. Okay, so like Staphylococcus, the most pathogenic one is Staphylococcus aureus. Okay, and it can cause many disease, infections in human, mostly in the skin. Yeah, mostly skin infection because Staphylococcus usually live on skin. So several skin infection like carbuncle, impetigo, scalded skin syndrome, and they can also enter into the system and causing disease on the bone. It's called the osteomyelitis. Eh? It can also cause disease, systemic disease in the heart, endocarditis, and also TSS, okay, toxic shock syndrome. It can also cause intoxication, especially if taken by food, and it might also cause pneumonia. Okay, so this is Staphylococcus aureus, which is the most pathogenic type of Staphylococcus. There is another Staphylococcus that can also cause disease or infection in the surgical area, endocarditis, and urinary infection. For the Streptococcus, there are several type, and the most pathogenic one is the pyogene, Streptococcus pyogene. Mostly also can cause skin infection, okay, pyoderma, erysipelas, and necrotizing fasciitis, which is the necrosis of the muscle cell uh, under the skin, okay, and then can also cause scarlet fever, rheumatic fever, uh, pharyngitis. This is common in children, sinusitis, and it is go to the kidney. It can cause glomerulonephritis. Another streptococcus like agalactiae, disease can cause infection, especially on the wound, meningitis for children, uh, sepsis, okay, in children, and also endocarditis, maybe also pneumonia on children. Okay, the next one is Enterococcus or Enterococci. It can cause infection, especially on the surgical area. Urinary tract infection. Viridans, this is mostly in the mouth. So we talk about the viridin Streptococcus. This is the one that mostly causing the dental caries and might also cause the endocarditis. Streptococcus pneumonia, this is the one that causing the pneumonia. So this is the main bacteria that causing pneumonia in human. And also this is the one that actually causing the otitis media, especially to children, and sinusitis. It can also cause meningitis in adult. The next one is Neisseria, and the most uh, famous one is Neisseria gonorrhoeae, which is causing the gonorrhea, which is one of the sexual transmitted disease or STD. It can also causing uh, gonorrhea in eyes, gonococcal ophthalmia in the eyes. And the next one is Neisseria meningitidis, and this is the primary pathogen that cause meningitis in human, especially in children. Okay, we start with the first one, the first group, which is Staphylococcus bacteria. And again, it's going to be round bacteria that arrange together to make a cluster groups. So this is the characteristic of Staphylococcus. This is under the electron microscope over here. This is even closer with a higher magnification. So you can see several round coccus bacteria. They bind together, they group together, they arrange together to make a staphylo cluster. And Staphylococcus is actually common inhabitants in the skin. So many of them is actually normal flora, which is important for us to help against the pathogenic flora. Again, they're going to be a spherical cell or round cell arranged in the irregular cluster. They are gram-positive. Right? So Staphylococcus are gram-positive bacteria. They do not have spores and they do not have flagella. So just for your information, in general, round bacteria, they do not have flagella. The one that have flagella, usually the bacillus or rot bacteria. So this is round bacteria. There will be no flagella. They might have capsule. Okay? Therefore, some of them able to protect themselves against phagocytosis. There are about 31 species of Staphylococcus. The optimum temperature is 37 degrees. This is about 98 degree Fahrenheit, which is this is our body temperature. So this is human body temperature. It means that they actually like to live on us. So they are actually make a colony on our body, especially on the skin. They are facultative anaerobe. Remember, facultative mean they're able to live with or without oxygen. Say, with or without oxygen. So they're able to live with the oxygen condition or without oxygen situation. They are tolerant to salt. eh? So remember, our skin mostly salty because of the sweat. So they're able to live in salty condition. They're also tolerant to pH, acidic condition. Remember also, sometimes our skin in acidic is acid pH. So they're able to live in this condition too, and they're able also to live in tolerance to the high temperatures. Okay, so these are some characteristic of Staphylococcus, and they produce many virulent factors. Okay, remember virulent factor mostly enzymes and toxin. There are maybe some other chemical that is used as virulent factors for this bacteria. Okay, again, just remember again, virulent factors mean the factor that cause disease. Okay, so virulent factors mean any factors that produced by the bacteria that cause disease to human, like enzyme, they destroy cells, toxin also destroying our cell. So this is the one that actually causing the disease, and this is what we call the virulent factors. Okay, these are the virulent factors of Staphylococcus aureus. Okay? Just remember again, this is the most pathogenic Staphylococcus. Okay, so Staphylococcus aureus is the most pathogenic type of Staphylococcus bacteria. Because what? Because they have so many virulent factors that might cause disease to human. What are these virulent factors? First, coagulase. If you see ACE like this, it means enzyme. So enzyme usually end with ACE. Okay, so ACE, ACE. So all of these are enzymes. Enzyme that able to break down our cell or maybe do things that causing disease to us. Okay, so coagulase, they actually coagulate the blood plasma. So the blood plasma become very sticky, become coagulate. Okay, and then the hyaluronidase. This is the one that actually digests the connective tissue of the host. So this is the one that digests some maybe tissue under the skin, and then it's break down that tissue. So digest the connective tissue. Staphylokinase, this is special enzyme produced by the Staphylococcus that will digest the blood clot. Okay, so you can imagine here, the top over here is actually coagulate the blood, and then there is another enzyme that digest that coagulation. So give you bleeding, sometimes it's not, sometimes coagulate, sometimes bleeding, and etc. So this is how these bacteria able to produce these two enzymes that work differently. Okay. Lipase, the name is telling you, this is the one that digests the lipids, oils. So this is digest the oils. Remember, our skin produce oils because we have oil glands under the skin, and these bacteria are able to digest these oils. So using the lipase. This is the one that is special for Staphylococcus aureus, which is it has penicillinase. Remember this penicillinase is the enzyme that inactivate penicillin. So it means that if we give penicillin to cure the Staphylococcus aureus infection, mostly it will not working properly. Because what? Because the penicillin will be destroyed by this penicillinase, the enzyme that is produced by the Staphylococcus aureus. And this is also the reason why the base bacterium is very resistant to penicillin. There is group of Staphylococcus aureus is called the MRSA, methicillin resistant Staphylococcus aureus. This is actually the one that very resistant against penicillin type of antibiotics. Okay, these are the enzyme. Now the toxin usually end with IN. Okay, like hemolysin, leukocidin, enterotoxin, okay, exfoliative toxin, and TSS toxin. So these are the virulent factors in the type of toxin. Now, the name is also telling you what they do. Like hemolysin is mean that they actually lyse, which is break the heme. Heme is blood. So this hemolysin, they break the red blood cell. Okay? Break the red blood cell. And there are four type of hemolysin that is produced by this Staphylococcus aureus, which is alpha, beta, lambda, and gamma. Okay, and then leukocidin is telling you this is the one that break the leukocyte. So leukocyte is white blood cell. So example of white blood cell are neutrophil and macrophages. Remember there are five types of white blood cells and two of them fight against bacteria, which is neutrophil and macrophages. So again, this leukocidin will break this type of white blood cell. Enterotoxin. The name is telling you this is entero mean GI tract. Eh? So this is the toxin that induce the nausea, vomiting, diarrhea. So this is in the GI tract. Okay, so the action is in the GI tract. Entero mean GI tract. Exfoliative toxin. Again, this is telling you exfoliative means separate the top and the bottom, which is they separating the epidermis with the dermis of the skin. So it's break down the skin structure. And the next one is TSS toxin. This is also causing the intoxication, induce fever, vomiting, organ damage. So these are some of the virulent factors produced by Staphylococcus aureus. This is actually the test made to identify the Staphylococcus aureus. So we have the media over here, culture, contain blood, okay, and then this is the Staphylococcus aureus. Okay, Staphylococcus aureus. This is colony. Okay, this is a colony of Staphylococcus aureus. So if you see here, you see the clear zone over here around the Staphylococcus aureus. The clear zone mean this Staphylococcus aureus is actually digest this blood using the hemolysin. Hemolysin. eh, and also the toxin, alpha toxin. So this blood is actually being destroyed. Therefore, you don't see blood around here because it is being destroyed or digested by this Staphylococcus aureus. It also gives another area over here, which is caused by the alpha toxin. So there are two toxins, the alpha and beta. Okay, alpha causing this digestion around this Staphylococcus aureus, and delta give this indication, right, of the presence of beta toxin. Okay, now epidemiology of this Staphylococcus aureus. They are present in most environments that frequently the area where humans live. So any environment condition, then this Staphylococcus aureus will be there because they are actually part of the human colonizations. Okay, so they colonize in human skin. They are also readily isolated from fomite. So what is fomite is any non-living object, okay, touched by human that carry Staph aureus. Okay, so like for example, doorknob, maybe computer keyboard. Okay, so that's fomite. Carriage rate in healthy adult is about 20 to 60%. It means that this Staphylococcus aureus is carried by 20 to 60% human, and sometimes they do not cause disease. Okay, asymptomatic. Mostly carries in the anterior nares, the nose, skin, nasopharynx, and some in the intestine. Okay, so the high risk of infection, especially someone with the poor hygiene, nutrition, they have tissue injury, it has pre-existing infection, diabetes person, and someone with the immunodeficiency like AIDS people. Okay. And its increased resistance against methicillin or penicillin is called the MRSA. Okay, now the disease. Okay, Staphylococcus aureus disease, mostly localized skin infection. So cutaneous means skin. So this is local skin infection like folliculitis, furuncle, carbuncles, and impetigo. This is example of skin infection caused by Staphylococcus aureus. Okay, it can also cause the systemic infection. Okay, the first one local in skin infection. Now the second type is systemic infection, maybe osteomyelitis. Okay, so this is osteomyelitis over here, which is infections in the bone, especially in the metaphysis area, okay, close to the top or the end of the bone. It can also cause what we call the bacteremia, which is the presence of bacteria or staphylococcus in the blood. So if we take a blood sample and we do the test, then it will positive give the positive results of presence of the Staphylococcus aureus. The third type of infection is toxigenic disease, maybe food intoxication, if it is carried by the food, oral transfer. Second is Staphylococcus scalded skin syndrome, which is this one over here. Okay, so this is the Staphylococcus scalded skin syndrome, and it also causes the toxic shock syndrome. Right? Maybe this syndrome can lead to some organ failure. Okay, that's the Staphylococcus aureus. Now we go to the other Staphylococcus, some coagulase negative Staphylococcus bacteria like Staphylococcus epidermis. This is actually our main normal flora, live in the skin. Staphylococcus hominis, this is also in the skin, but especially around the apocrine sweat gland, the sweat gland that produce stickier sweat, which is maybe under the armpit. That's where the apocrine gland located. Staphylococcus capitis, the name is telling you, is live on the cap or the head, mostly on the scalp and face, ear. So these are Staphylococcus capitis. The next one is Staphylococcus saprophyticus, mostly in the groin area. So genital area. So this one can cause the urinary tract infection. So they live in the skin around the genital area. So these are uh, other type of Staphylococcus bacteria that might cause disease to human. This is how to identify the Staphylococcus uh, and also distinguish them with the Streptococcus. So the first test that used is called the catalase test, and this test will distinguish between staph bacteria and strep or streptococcus bacteria. So with the catalase test, if it is positive, it is telling us this bacteria is staphylococcus. If it is negative, the result is negative, then the bacteria is streptococcus. Now, how is the positive and negative test look like? So this is how the positive test look like. You see the bubbles over there, and this is negative test. Okay, so if it is like this, then bacteria is Streptococcus bacteria. If it's positive like this, then this bacteria is Staphylococcus bacteria. Now, after we get the positive test, then we can perform another test to continue to know whether the bacteria is Staphylococcus aureus or other Staphylococcus bacteria using the coagulase test. Okay? So when it is positive, it means that this bacteria is Staphylococcus aureus. But if the result is negative, then the bacteria is other than Staphylococcus aureus, maybe Staphylococcus epidermis, capitis, okay, hominis, or maybe Staphylococcus saprophyticus. This is positive result over here, coagulase. You see the coagulation, uh, and this is negative result like this. So if you see this result, then this actually the Staph aureus. Okay, so this the two tests again, the catalase test, coagulase test, differentiate between Streptococcus and Staphylococcus, and then coagulase test pinpoint whether the Staphylococcus is aureus or other Staphylococcus. This is the test that's usually done in clinic to identify Staphylococcus bacteria. Eh? So the sample usually taken from the pus, the tissue, exudate, maybe from the sputum, from urine sample, or maybe from the blood. Eh? Then it will perform that one of them is catalase test and coagulase test. Eh? And some other tests, this is a complete test over here. This is negative result. So there is no changings in this set of tests. And this is positive result. If you see this one is become yellow, 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 so it means that it's become acidic, acidic, acidic condition. So this Staphylococcus aureus change these chemicals, liquid, into acidic pH, produce the carbon dioxide, and it's changed the color. So when the color is changed, then it give us the positive result. So this positive result mean that Staphylococcus aureus presence in the sample. Okay, now some concern about the Staphylococcus infection. Again, 95% of Staphylococcus aureus has or produce enzyme called the penicillinase, the enzyme that break down the penicillin, and also ampicillin and other type of penicillin, the one that have beta-lactam uh, structure, eh? And it create a group of Staphylococcus called the MRSA. Usually, if patient have the MRSA type of Staphylococcus aureus, then doctor will give another antibiotic, which is vancomycin. So vancomycin is effective against MRSA. If the skin infection that caused by this MRSA sometimes require surgery in order to remove that infection. Okay, so again, the treatment, if it is just Staphylococcus aureus, they usually use some antibiotics. Mostly clindamycin is being used. If it is MRSA, then mostly the vancomycin will be used to treat this infection. And if it is actually vancomycin resistant Staphylococcus aureus, then the doctor will give another antibiotics like quinupristin, uh, dalfopristin, and this is going to be the last choice of drug used for the Staphylococcus aureus. Now, prevention is really important, eh, especially for us if we do not have the Staphylococcus aureus infection, it is better to protect ourselves against this disease. First, of course, the universal precaution by the healthcare providers, hospital clinics, so the hospital workers who carry this Staphylococcus aureus, then they have to be banned or removed from carrying some people that may be sensitive to Staphylococcus aureus, like children or older people. Okay. Of course, our hygiene and cleaning our environment and our body is really important. And there is also vaccine to protect us against this Staphylococcus aureus. But this is still in clinical trials. Okay, so we done with the Staphylococcus. Now we go to the next type of coccus bacteria, which is Streptococcus. Again, this is round bacteria that arrange in chain. Okay, so strepto means chains coccus bacteria. This is under the microscope. You see the chains arrangement of this round bacteria. Okay, this is also gram-positive bacteria like the Staphylococcus. Also do not have spore eh, and do not have flagella, so it's non-motile. They also can produce capsule and slime layer. Okay, so capsule and slime layer. The Staphylococcus mostly only use capsule, no slime layer. They are also facultative anaerobe. It able to live with oxygen or no oxygen. So that's facultative mean do not form catalyst. So this is the reason why it is can be used to distinguish between Streptococcus and Staphylococcus by using catalyst tests. Most parasitic form are fastidious. It means that they like blood. Okay, so they like blood. So therefore, if we want to culture them, then it is required to give mix the culture media with blood. They are sensitive to drying, heat, and disinfectants. So it's easy to protect us against this Streptococcus by, for example, washing our hand, clean our area with the disinfectants, maybe the kitchen tables, for example. Now the separation of Streptococcus groups, bacteria, using two tests. They there are some of them that actually produce what we call the beta-hemolytic. This is how it look like under the on the petri dish test, and alpha hemolytic group. The beta hemolytic groups is become group 1, group A, which is the most pathogenic one, the Streptococcus pyogenes. This is the one that causing most problem in human. Group B and C also beta hemolytic, and then the alpha hemolytic, if it is optosin sensitive, it is actually Streptococcus pneumonia, the primary cause of pneumonia in human. And it is optosin resistant. This may be group D and viridans bacteria, the one that mostly causing the dental caries. Okay, so this is the group of Streptococcus and also some of the infection that they can cause. The most pathogenic one is Streptococcus pyogen. This is group A. They have beta hemolysis type. They live in human throat. Eh? They can cause infection to the skin, strep throat, and scarlet fever. Streptococcus agalactiae is a group B, also beta hemolysis. Their habitat usually genital area like vagina. They can cause problem to baby neonatals and also cause infection to the wound. Strep equi, this is C type. Uh, this is in mammal. Uh, this galactia, this is also in animal. Right? So these two are the one that causing disease in human. Okay, the next group, I just point out the one that cause infection in human. Streptococcus sanguinis, right? Oral cavity. It can go to the heart, causing endocarditis. Uh, Strep mutans. This is mostly in human oral cavity. This is the one that mostly causing the dental caries. Strep pneumonia. Again, this is their habitat is human respiratory tract, and this is the primary cause of pneumonia in human. Okay, we start with the first one, which is the most pathogenic one, the type of Streptococcus that causing most problem in human. This is the most serious uh, Streptococcus pathogen. They are strictly parasite. Eh? They inhibit throat, nasopharynx, and also skin. So they have virulent factor, enzyme, and toxin, but they also have additional. Additional virulent factor is called the surface uh, antigens. So this is additional virulent factors of Streptococcus aureus. Just remember, mostly enzyme, okay, toxin, that's the virulent factors. So in addition of this enzyme and toxin, they also have this surface antigen as virulent factor. C carbohydrate. Okay. This one over here. Okay. So they have structure called the C carbohydrate that also used for as a virulent factor causing disease to human. Fimbriae, of course, this is part of the virulent factor that help them to attach to the host cell. The M protein, long M proteins over here, this helped them to be resistant against phagocytosis. Okay? And then hyaluronic acid capsule. So it has capsules, okay? And this capsule again also protect them against the white blood cell destruction and also provoke no immune system. It means that this acid capsule will make them unable to be detected by the our immune system. C5a protease, eh, this is another enzyme. So ACE mean enzyme that respond to neutrophil, which is one of the phagocyte. So these are additional virulent factors of Streptococcus pyogen that help them protect against host defense. Okay, now the toxin, the virulent factors in the toxin type, streptolysin. Okay, this is actually hemolysin, which is lyse or break the hem, the red blood cell. Iatrogenic toxin, which is pyrogenic. And this is pyrogen. This is the one that increase body temperature, okay, or fever. This is inducing the fever. Super antigen. This is the one that cause release of necrotic factors of our immune system, and it's gonna be breaking some cell, including cell under the skin like the muscle cell, kill the cell. Okay, and then the enzyme, it has streptokinase, digest the clot, the fibrin clot. Hyaluronidase, this is the one that break the connective tissue. This is the same like the Staphylococcus enzyme, hyaluronidase. DNAase, and this is the enzyme that actually break down the host DNA. It's actually destroy the DNA of the host cell. Now the epidemiology, Streptococcus only have human as a reservoir. So animal will not carry this type of Streptococcus pyogenes, only in human. Sometimes there is an apparent carrier, it means that no symptom, no sign for this carrier. Transmissions mostly on contact, droplet, food, or maybe fomites. Portal of entry, mostly skin and the pharynx, GI tract and respiratory tract. Children is the predominant group that affected by this cutaneous and throat infection. Okay, strep throat, so mostly affecting children. Systemic infection and progressive sequela possible if it is untreated. So sequela mean organ damage. Okay. Okay, the disease caused by this Streptococcus pyogen. First, skin infection like impetigo, like this ones over here. So it's in children. And erysipelas. This is caused by the Streptococcus pyogenes. And especially on children, they can also cause the strep throat. Okay, Streptococcus pharyngitis. Systemic infection for this Streptococcus pyogen, scarlet fever, and then septicemia, which is the bacteria in the blood, pneumonia, and streptococcal toxic shock syndrome. This is a type of systemic infection that are caused by Streptococcus pyogen. Now, the long-term complication, it can cause rheumatic fever, and usually followed by the subclinical pharyngitis and acute glomerulonephritis. So this is in the kidney. Okay, so this is kidney, causing kidney failure. And also it can cause some heart failure because they actually can stay in the valve. There are four valves in the heart. Okay, two atrioventricular valves, and there is also aortic valve and the pulmonary valve. So they usually stay in this two atrioventricular valve, which is the left side is the mitral or mitral valve or bicuspid valve, and the tricuspid valve on the right part of the heart. So they're able to uh, break and destroy this valve, causing problem with the circulation, with the heart contraction. Okay, the next group is Streptococcus agalactiae. So mostly they reside in vagina, pharynx, and large intestine. They can cause most prevalently problem to the baby, the neonatals, causing pneumonia, meningitis, and maybe sepsis. Okay, so the pregnant woman should be screened and treated for this infection in order to protect their baby from the infection. They can also cause the skin infection in the wounds and endocarditis, inflammation of the heart. Okay, the next one is group D, C, and G. Okay, so group D, this is faecalis, faecium. It means that they mostly in the lower GI tract, like in the large intestine, the colon. Group C and G, usually on the upper respiratory tract, pharyngitis. They can also enter into the kidney, causing the glomerulonephritis and bacteremia in the blood circulation. Okay, treatment for the group A, okay, strep pyogene, and group B, they usually treat by penicillin. For viridans, the one that usually in the mouth, Oralis, salivary, sanguis, miliary, mitis, mutants, they all mostly live in the mouth. Okay, this viridans group can cause bacteremia, which is presence of bacteria in the blood circulation. It can cause meningitis if they go to the nervous system, abdominal infection, and tooth abscesses. Most serious infection of this Streptococcus viridans is the subacute endocarditis, which is causing problem on this lining of the cardiac valve. So it's gonna be causing some problem with the heart contraction and also blood circulation. Okay, again, still in the viridan groups, mostly the one that live in the mouth, and it can cause mostly dental caries if it is not removed or clean. Okay, the next group is, or the next species is Streptococcus pneumoniae. And again, this is the primary pathogen that cause pneumonia in human. About 60 to 70% of pneumonia cases is actually caused by this Streptococcus pneumonia. It also can cause the otitis media, especially to children. Okay, so because these bacteria are able to climb into the ear, the middle ear over here, and causing that otitis media. And just remember, children ear is actually in the straight line with their mouth. So therefore, children usually will be have a higher risk of having this otitis media when they are growing up, the ear actually also uh, increase a little bit, so it's going to be more difficult for this Streptococcus pneumonia to reach the middle ear. So that's the reason why most of the otitis media happens in children. Okay, epidemiology, 5 to 50% people actually carry this uh, pneumonia, I mean the Streptococcus pneumonia, okay, on their nasopharynx. Sometimes it will not cause infection to them, but they're still able to transfer to other peoples. So pneumonia actually occurs when this cell go to the lungs. Okay? Especially it happened to people that still have lower immune system, like children. Elderly, they usually have lost some of their immune capability. Some people with the immune compromised condition, like AIDS patient, they usually easy to get this pneumonia. Again, this bacteria can gain access to the ear by using the eustachian canal. Okay, so the canal that lead to the middle ear and causing the otitis media. Treatment for this Streptococcus pneumonia, usually using the penicillin. Remember, penicillin usually used for gram-positive bacteria. So mostly it will be used for Streptococcus and some other gram-positive bacteria, except the Staphylococcus aureus, because Staphylococcus aureus has resistance against the penicillin. There is also vaccines available for pneumonia. Okay, the last group will be Neisseriaceae. This will be consist of Neisseria, Brandhamella, uh, Acinetobacter, and this group of bacteria mostly it has two round coccus that bind together, making what we call the Diplococcus arrangement. Okay, this Neisseriaceae group of bacteria, they usually are resident of mucous membrane of warm-blooded animal. So in our mucosal tissue, this bacteria includes Neisseria, Brandhamella, and Moraxella. And the two primary pathogen to human is Neisseria gonorrhoeae and Neisseria meningitidis. So these are the two primary human pathogens from this group. So we will focus on these two Neisseria. So again, Neisseria, you see this one? So it consists of round two round bacteria that combine together. Okay, so this is actually two round bacteria that combine together to make this Diplococcus. Okay, so bean shape Diplococcus, two round bacteria that arrange together. No flagella, of course, because this is round bacteria. They have capsule and pili. This is additional virulent factors of this Neisseria group. They have pili that become additional virulent factors. Just remember, virulent factors mostly enzymes and toxin. Okay, plus other, like for this Neisseria, they have pili as the virulent factors. Okay, this is other factor that also increase the virulence of this bacteria, like Fimbriae, is used for attachment. IgA protease, which is enzyme that will destroy the IgA, the antibodies A. Epidemiology, it is strictly human infection. Okay? For the gonorrhea, so this is Neisseria gonorrhoeae. This is strictly human infection, and this is one of the 5 STD, top STD in the United States. The infectious dose is very small, which is 100 to 1000. It means that 100 bacteria can cause or can start the infection. This is the case that is reported in the United States from 1941 until 2020. If you see the graphics is increase and decrease and increase again around 1980, 1970, and then going down again, and then now it's decreasing again. Okay, so this is the increase and decrease case of gonorrhea. It's never gone. It's actually sometime decreasing and sometime increasing case. For the male, they usually can cause what we call the urethritis, which is infection in the urethra, because this is actually the primary uh, entry, okay, the entry point, portal of entry of this disease, which is using this urethra. On the female, usually they causing infections in the uterine duct, the fallopian duct, and sometimes can cause the abdominal problem, and also causing what we call the tubal pregnancy, which is pregnancy outside the uterus. So it happens in the uterine tube over here. Okay? And also vaginitis, infection of vagina, and urethritis, infections of urethra, and salpingitis in female. And this is just commercial that happening around 1970, 80, okay, for to warn people for prostitution, that maybe they can contract the disease from this sexual intercourse, with the prostitutes. Okay, if this gonorrhea go out from the genital area, okay, it can also cause infection outside on these organs. So for example, it can cause what we call the proctitis in the on the anus, gingivitis if it is goes to the mouth, and maybe pharyngitis. Uh, it can also cause infection to the eyes, yeah, conjunctivitis. Some of them even enter to the bloodstream and causing chronic arthritis if they go to the joint tissue, and then some rash on the limb. Meningitis and endocarditis is a rare complication of this Neisseria gonorrhoeae. In children, especially baby, so it might cause blindness to the newborn, okay, which is eye inflammation. So if the mother have the gonorrhea, the baby might have it also, and then it's very dangerous for them because it can cause blindness to this baby. Diagnosis and controls. usually using penicillins and tetracycline to destroy this Neisseria. Just for information, Neisseria is actually gram-negative bacteria. So the old penicillin maybe is not effective against the gram-negative bacteria, but the new type of penicillin may be broad spectrum that can also use for gram-negative bacteria. So therefore, sometimes penicillin, the new type of penicillin and tetracycline are used for treatment of this gonorrhea. Okay, the next one is Neisseria meningitidis, which is the most common bacteria that causing the meningitis in human. Additional virulent factors, they have capsule, fimbriae, IgA protease, endotoxin. These are the virulent factors of Neisseria meningitidis. And again, this is the prevalent bacteria that causing meningitis in human, especially baby, and can also causing epidemic. So where is meningitis located? It is located in this layer of brains and spinal cord. It's called meninges. So when bacteria live in this meninges, then it can cause inflammation on these meninges. That cause is called the meningitis. And human is the reservoir for this bacteria. Usually carry in nasopharynx. Uh, Children usually high risk for this meningitis. Okay, so when the bacteria enter to the bloodstream and then go to the meninges, then it can causing the inflammations of this meninges, and this is what we call the meningitis, which is inflammation of meninges. This is examples of baby that have meningitis. Eh? So you see that ones. So it can cause hemorrhage, which is bleeding, and then coagulation, vascular damage, necrosis. So this you see, this is actually necrosis under the skin, especially in the lower extremities. Okay, the leg and the foot. Treatment usually with type 4 penicillin G, and this is a broad spectrum of penicillin that can also used for gram negative bacteria like this Neisseria, and also using the cephalosporin. Okay. There is also prophylactic treatment, which is prevention treatment for the family that maybe contact with the meningitis. There is also vaccines available for this meningitis. The next one is Brandhamella and Moraxella, and they are mostly opportunistic bacteria that can cause disease, especially to people with lower immune system, and also Acinetobacter. So that's actually all these coccus bacteria, gram-positive and gram-negative bacteria that cause disease to human. That's all, I think, and then see you again on the next chapter, chapter 19 and 20. We'll discuss about the bacillus bacteria. Okay? See you then. Bye-bye.